Well, after a lengthy, very lengthy meeting, the County Board of Supervisors declared medical misinformation a public health crisis this week. Joining us right now, County Supervisor Jim Desmond. Jim, good morning.
Hey, Raul, good morning.
You voted against this measure. Why?
Well, I mean, there's been many contradictions throughout this entire pandemic. You know, it was mask on, mask off. If you take the vaccine, you won't have to wear masks anymore. Restaurants opening and closing. I even asked the direct question at one of our meetings is, does the vaccine fight all of these variants? The answer was yes. I don't think anybody's, maliciously putting out bad information, but this whole thing has been evolving. And I voted against it because there's no one point in time. I don't think we have today all of the information about the virus. And so, what's misinformation and what's not. And I think that was more of the crux of it is We really don't have all the information right now. And people should be able to question authority. They should be able to do their own research on this. Some medicines work for some people, some work for others. And so I think it's the misinformation. I didn't vote against, we should have misinformation, but this is still evolving. I don't think we have all the answers right now, so that's why I voted against it. And many people were very passionate there.
Sure.
Is that there shouldn't be one authority telling us, what we should be doing all the time. We should be doing our own research and question.
Yeah, and for those trying to figure out exactly what this means, was this more symbolic, or by declaring it a public health crisis, what does that mean? There's punishment involved for people who essentially, for lack of a better word, are caught disseminating misinformation? Or explain what it does.
Well, it's not a lot, to be honest with you. What it does is it's going to create a website to where apparently the county or somebody, that hasn't really been decided, who's going to determine what's misinformation and who's not. But once they do, they're going to put it on a website, say here's the right information, and here's what you might be hearing on social media or other things, and here's why it's wrong. So
like a fact check
so
website?
That's basically what's going to happen initially. There could be potentially fines. So what would happen was this statement was made that misinformation is bad. But there's not a lot of teeth on meat on the bone right now moving forward. But to me, it just kind of infringes on people's freedom of speech and doing their own research and questioning authority is kind of really what it goes back to.
But
creating a website doesn't do a lot.
Playing devil's advocate, how would that infringe on people's free speech? I mean, people obviously were not infringed on their free speech during the 15 hours.
No.
And what's wrong with the fact check website? Just asking.
Well, and there's absolutely nothing wrong with a fact check website. It's more about who is going to determine what is misinformation and what is not. Because obviously nobody really knows yet. This whole thing is evolving. We're evolving
in real time.
I think that is more of the fact. And you're right. It's not more about free speech, but it's about only listening to one narrative. Listen to what the government is telling you. Don't do any more information. Don't do any. Anything you might do or find out on the side or somebody else might come up with is wrong. So I think that was more of the, the infringement on people's rights and liberty to be able to look at other information and make their own determinations instead of listening to one side of the government.
Were you surprised at how many people signed up for all those hours? And it seemed like an unusually high, everybody split 50-50 on everything, it seems, these days. But yet the entire group seemed to be all against this that showed up.
Well, they were very fired up. People don't like being told what they have to do and to only take one point of view. So it was what was really kind of encouraging to me is it was a vast, different group or diverse group of people. I mean, you had young people, you had old people, you had people of color, you had people from all sorts of different backgrounds, all coming and saying they were very upset the fact that who's going to decide what's misinformation and who's not. And so I think that was the crux of it. People were very passionate. I mean, that item alone, I think, had about 7 or 8 hours of hearings, and people aren't happy with being told, they only listen to the government
But it's not just the government. It's a lot of medical experts and scientists saying things. It's not just government officials. It's doctors, it's scientists, it's researchers, people who are doing scientific research.
Well, absolutely. And even those doing the scientific research disagree. I mean, scientists disagree. When Dr. Galley came out and he said, he said we were going to shut down restaurants for the third time. He even admitted it wasn't even based on science. That he was shutting them down because they didn't want people to gather.
Sure. I mean,
so
I understand,
to say there's only one
to a
source
certain
of information.
Point, what about
and you're right, doctors, scientists all disagree.
But what about the argument of erring on the side of caution when this is an unprecedented virus none of us have ever lived with? Where is perhaps patience to kind of play it out? We're all expecting all these doctors and scientists to get it all right the first time. When this is playing out, like you said, it's changing daily. Exactly. It's changing daily. You can't expect scientists and researchers and people to have all the rules right. If next week everything changes, then we have to go with those changes, right? Why is the expectation that you better be right now and you can't change it?
Well, and that's exactly the point. And that's exactly why people were saying we don't have all of the information right now. To put up a website that says
but in the process, if people are dying, we have to get something changed.
It's like saying we know everything
to help that process. No?
I'm sorry, I didn't hear you.
If that's why the information changes, though, because you still have to do something to prevent deaths, to prevent further illness. So to just say nothing because it's changing doesn't seem to make any sense for all hospital people and doctors and nurses putting their lives on the line.
You're absolutely right. So there is no really one point in time where we have all of the information. We have to let it evolve, and we have to be able to change as it changes. So I think that was the point, is who's going to determine, today's facts are tomorrow's misinformation. Let's evolve. Let's do the best we can. And I'm all with you. We should err on the side of caution and move forward. It's just more of, we don't know everything right now. Why are you going to determine what's misinformation and what's not? Let the people decide for themselves and their own doctors.
We don't know everything right now, that's for sure. So that's why people are saying, well, do what we can as we try to figure it out so that more people don't die. What is your message to San Diegans? Do you agree with wearing masks in classrooms? Should we be wearing a mask everywhere? Now they're saying that you have to wear a mask if you're doing after-school activities. Is that preventative enough for you? Or if not, what do you want to tell folks right now?
Well, I guess as far as the masks are concerned, if you're concerned and you want to wear a mask, go ahead and wear a mask. As far as kids in school, I don't think kids in schools, should have to wear masks all the time. It's, to me, they're the least vulnerable group.
Why not?
Quite
just
frankly,
respectfully, why not? I mean, you've seen what's happening in Afghanistan and people struggling from actual oppression, from actual oppressive governments. And is a mask something that you feel is on that kind of level? Or doctors are saying wear a mask. I don't know any better. Honestly, I'm the one that said, look, I could read all the articles I want. If a doctor says it, I have to at some point trust the people who have studied this for decades. I'm not going to sit up here and say, I know the science, I know that. I don't.
Well, if you let me finish, you could go to 10 different doctors and you'll get 10 different answers. So who are you going to listen to? Because if you go to your own doctor, maybe your own doctor has told you, you don't really need a mask. The masks aren't that effective, especially the cloth masks that are out there right now. There's gaps all around the sides. The virus is tiny, very super tiny. And so, I don't think children should have to wear masks. They're the ones that are the least vulnerable. And what we also want to build up is our own immunity. There are your own antibodies, and that's children's immune systems are still evolving. They're the most healthy. They're the ones that we don't want to rely on vaccines all the time for every virus or everything that comes along. We have to build up our own natural immunity, and children for the next generation are the best place to build up that natural immunity, in my opinion, so that we don't have to keep going through this cycle every time a virus comes out. That's my opinion on why children should not have to wear masks in school. There's other opinions out there. I respect them. People should be able to make their own choices. There's many different professionals out there with many different ideas. We should listen to them all and make the best decisions we can. I think
most school districts are disagreeing with you. That's why you're seeing everybody going against Governor DeSantis in Florida, and in Texas you're seeing all the same thing. Supervisor Jim Desmond, we thank you for the time as always. Always glad to hear your opinions.
All right, Raul. Thank you.